Hello, everyone. You're listening to Alternative Revelations with Linda Emmanuel. And today is podcast number 19, all about hormones, how Mycoplasma disrupts the endocrine system, and people who have Mycoplasma infections have hormonal imbalance. And with that said and done, let's begin the podcast. Now, my heart goes out to people suffering from hormonal imbalance because of a Mycoplasma infection, and usually their doctors cannot tell them why. And this is very frustrating. I went through the same thing, doctors not being able to give me an answer. And that's what these podcasts are about, to educate you about the symptoms of a Mycoplasma infection and also ways to kill Mycoplasma and get well. So I'm going to start off with some symptoms of a Mycoplasma infection. And first of all, Mycoplasma infections are triggered by a trauma or extreme stress, and I will tell you exactly what happens in the body when this happens and why, and what endocrine system organ causes the fight or flight syndrome. That's when Mycoplasma wakes up. Now, the symptoms of a Mycoplasma infection are as follows: chronic fatigue, fibromyalgia, chronic headaches, and bouts of nausea, hypersensitivity to temperature and barometric pressure changes, cognitive problems, meaning brain fog, short-term memory loss, emotional imbalance, meaning bipolar or depression, endocrine system hormonal imbalance, reproductive system problems, meaning infertility, which may include loss of libido, endometriosis, and spontaneous abortion, granulomas under the armpits, frequent bouts of generalized pain, reduced blood volume, and gout, but not in all cases. And I did explain chronic fatigue in the podcast before this one. But this podcast is all going to be about how Mycoplasma causes hormonal imbalance. And one of the things Mycoplasma needs is cholesterol. It's in a double cell membrane, which is called an endotoxin. And this is made out of a lipid and a sugar. So it definitely needs fat to replicate. The easiest place in the body to uptake cholesterol is in your endocrine system, where you make hormones. And there are many, many organs that make hormones, and any one organ can be affected. And it seems like a lot of people are having the thyroid problem and the hypothalamus problem, and actually the pituitary, and they can also have hormonal imbalance in the female or male reproductive areas. It all depends where Mycoplasma resides. Some people may get diabetes. They're not making insulin. So again, cholesterol is one of the preformed sterols that Mycoplasma uptake for replication. Cholesterol is an essential prerequisite to the generation of hormones necessary to the maintenance of the body's metabolic balance. And the sequence is as follows: coenzyme, squalene, cholesterol equals a hormone. If this sequence is disrupted by a Mycoplasma's uptake of cholesterol, the production of various hormones is interrupted with, as in the case of the hypothalamic regulation of sleep or body temperature. When this happens, irregular sleep patterns and extreme sensitivity to temperature occurs. The description of the endocrine system is as follows: hormones are used to communicate between organs and tissues to regulate digestion, metabolism, respiration, tissue function, sensory perception, stress, growth and development, reproduction, and Last of all, mood. Hormones attach to cell wall receptors and change the cell's behavior. Diseases of the endocrine system are either hypo, which means they are not producing, or hyper, which means overproduction. And either can be caused by the gland not signaling the downstream organism or gland, or the gland misfunctioning on its own. For instance, the hypothalamus regulates the thyroid. So if you have dysfunction in the hypothalamus organ by mycoplasma, then your thyroid is not functioning. But if mycoplasma is involved in the thyroid, then the thyroid is malfunctioning on its own. Now, the first organ I want to talk about in the endocrine system, and of course this is going to be so simplified. There is so much more to the endocrine system. So this is going to be a very, very simplified explanation of these organs and what they regulate. And probably the most important, well, I guess they're all important, but a very important organ, which I consider a master organ, is the hypothalamus. And it's at the base of the brain where the spine comes up into the brain. So it is protected by the blood-brain barrier, but mycoplasma, again, is the smallest living organism. Picture a cell and look at the cell's nucleus in that picture, how tiny it is. That's the size of mycoplasma. It is just the DNA material of a bacterium encased in a membrane, but it still thinks like a bacteria, and it is actually the disease-causing bacteria, in contrast to the bacteria we have in our gut that helps us digest food. And since it is the tiniest living organism, it can cross the blood-brain barrier and actually attack the brain or reside in one of the organs that makes hormones and disrupt that hormone production, therefore causing a lot of havoc in the body because everything is driven by hormones. So part of the hypothalamus's functions are to stimulate and control the thyroid. It stimulates and inhibits growth hormones. It releases dopamine, which inhibits pain. And dopamine is associated with pleasure and reward. Schizophrenia involves altered levels of dopamine activity, and most antipsychotic drugs used to treat schizophrenia reduce dopamine activity. Now the next gland is the pituitary, and it is right underneath the hypothalamus and is about the size of a pea. And it regulates thyroid. It regulates growth hormones. It regulates the growth of the reproduction system. And its hormones target mammary glands, testes, and prostate. It also releases endorphins, which are made in the central nervous system and pituitary, and this is your feel-good hormones. Now the next gland is the pineal gland, and it is responsible for the release of melatonin, which regulates sleep. Now the next one is the thyroid. It releases thyroid hormones are to regulate metabolism. Now if you have hypothyroid, where the thyroid is not releasing hormones, where mycoplasma is actually in the thyroid and uptaking the cholesterol, and this is called Hashimoto. Now mycoplasma attacks degenerative tissue, and when the thyroid is degenerative, people usually are diagnosed with Graves' disease, which is the overproduction of thyroid hormones, and that's because the mycoplasma is attacking the thyroid gland, and this causes the thyroid to overproduce hormones. Now the next one is the adrenal gland, and people who have hyperadrenal gland, which means they're secreting too many hormones, they're diagnosed with Cushing's disease. That's Cushing''S. And the symptoms of Cushing's disease are obesity. Now the next one is dangerous. It can lead to death. It's called Addison's disease, and that's hypoadrenal gland, which means the gland is not producing hormones. The inability to maintain blood pressure and blood sugar that can be fatal. Now the stomach even has hormones. Hormones increase food intake and decrease activity. Also, hormones in the stomach stimulate gastric acid secretion. Now, the small intestine releases digestive hormones. The next is liver, which regulates cell growth and development. It also releases that hormone called hepcidin, which I talked about in the previous podcast about anemia. And of course, the next one is the pancreas, which everybody knows it releases insulin. So when mycoplasma is in the pancreas, it uptakes the cholesterol, and the pancreas does not make insulin, and people get type 2 diabetes. The next one are the adrenal glands. Now, these are very important. I mentioned before Cushing's disease and Addison's disease. Now, the adrenal glands play a really important part in causing or activating mycoplasma. They are the ones that release hormones. Like, let's say you are being attacked by a lion. Well, then your adrenal glands are releasing adrenaline. Adrenal glands of adrenaline. And this causes fight or flight. Now, the adrenaline boosts the supply of oxygen and glucose to the brain and muscles by increasing heart rate. Now, this is also where mycoplasma activates, because the release of glucose in the blood, and glucose is acidic. And this changes the pH of the blood to acidic. And this is when mycoplasma can awaken by a change in pH. If you remember from previous podcasts, mycoplasma monitors 3 things in your body: your pH, your immune system, and the oxygen level. Now, the next hormone I'm going to talk about is serotonin, and this regulates your mood and well-being. And this is why so many people are experiencing depression. And 90% of serotonin is found in the gastrointestinal tract. And drugs that alter serotonin levels are used in treating depression and generalized anxiety. Extremely high levels of serotonin can be toxic and fatal, meaning overdosing on antidepressants. Serotonin regulates memory, learning, depression, positive, negative, and cognitive symptoms of schizophrenia, aggression, dopamine release, and appetite. Now, serotonin is carried around in the blood by platelets. Now, the American Psychiatric Association characterizes chronic depression, meaning 2 years or more, as the following: 1. Fatigue or low energy. 2. Disturbance in sleep and appetite. 3. Feeling of hopelessness. 4. Decreased ability to concentrate or problem-making decisions. 5. Experience pain without a cause. Number 6. Loss of interest in normally enjoyable activities. 7. Delusional. Oh my gosh, these are all such symptoms of hormonal imbalance and a mycoplasma infection, especially with the pain, because mycoplasma can cause pain throughout the body. What I've learned about antidepressants is they burn out the frontal lobes of your brain in a matter of weeks. And then the patient or the victim is left without emotions. In other words, like a zombie. And again, my heart goes out to people suffering from depression because I know what it feels like to feel a sense of hopelessness and you can't enjoy any activities and you have no appetite and you cannot sleep. It's miserable. So if you do know somebody or you are yourself suffering from depression or hormonal imbalance, that this is caused from an outside source. It is not a mental disease. It is a physical disease. But doctors do not recognize mycoplasma. And like the podcast before, you cannot blame your doctor. I blame the system, the medical industry, for suppressing mycoplasma. Many people have lost their lives from overdosing from antidepressant drugs, or committed suicide other ways. And I feel like if these people knew the truth as to why they're having these symptoms, it really helps to understand why. That it is not your fault, that it is not something that can't be explained. Because doctors, when you ask them, they don't know. And depression is really close to me because I suffered from it. But one of my family members, a cousin, he was suffering from depression. And one of his early symptoms, and even later on, were huge granulomas under the armpits, huge black boils that would burst. And he had to get them operated on because he needed plastic surgery. That's how bad they were. And I asked him once, before he got sick, if he had some kind of a trauma. And his trauma was the breakup of with a girlfriend. She broke up with him and it broke his heart. And that was his trauma. So Dennis fought antidepressants his whole life. He could never get married. He always had to live with his parents. He became an alcoholic, very unstable. He didn't like the medicine. He said screwed him up even more than the depression. It affected him for 30 years until he was in his 50s. And he took off one day, and a day or two later they found him in a hotel. He had overdosed. He died. Very sad because he could have gotten well, I believe. But, of course, your family are the last ones to believe you. And nobody believes me, I guess because I don't have a DR in front of my name. And another case I'll never forget. I live in St. Louis, Missouri. And one of the suburbs of St. Louis, a woman who had been a nurse. And of course, when you're a nurse or in the medical field, you are exposed to mycoplasma. And if you have some kind of a trauma, you too can get sick. And this woman had been a nurse, and she was a mother of an 11-year-old boy and a 9-year-old little girl. And she was suffering from depression. And she had attempted suicide twice. And one weekend, on a Friday, she bought a gun. And she shot her 2 children and killed herself. And it really is sad because people do not know that there are ways to get well. There are ways to kill mycoplasma. And this poor woman, or this poor husband, he was left without a family. Now, one of my pet peeves or one of my interests is to look past history about monarchs and people, what they died of in the Middle Ages, like, for instance, Henry VIII and George III and Anne Boleyn and Elizabeth I. These people all suffered from mycoplasma infections. Now, Henry VIII, there is a documentary on YouTube by Lucy Worsley, and it's called Inside the Body of Henry VIII. And Henry never did have syphilis, like some people, the rumor goes around that he had syphilis. He did not have syphilis because doctors in those days documented everything health-wise of the king, because the king's health was the nation. So Henry did, at an early age in his teens, he did contract smallpox, but he survived it. And he was a very healthy person. And then when he was in his 20s, he got malaria. And people wonder, well, what about malaria in London? But London used to be real marshy, and they had a mosquito problem. And then Henry was a jouster. Henry was 6'1" and very strong and very athletic and very good at jousting. And he had an accident. He forgot to put his helmet down, and he was struck in the head by his opponent's pole. And from then on, he suffered from migraines. This could have been the start of a Mycoplasma infection, because one of the symptoms of a Mycoplasma infection is migraine headaches. And this jousting accident was a trauma. Well, he was doing okay until he had another jousting accident. And this time, his horse fell on him, a big horse. And he was knocked out for 2 hours, which is extremely dangerous. And from that moment on, he had bipolar symptoms. People didn't know when he would go off in a rage or when he was nice. And he killed, it's documented that he's killed up to 70,000 people during his reign. And because Henry VIII wore such tight garters around his calves, this caused ulcers. And from the accident, the jousting accident, he could no longer exercise. So he got up to 400 pounds. And people said that they could smell him coming from 3 rooms away. He was rotting from the inside out from bacteria. And he died, they stated. He had melancholy, which is depression. And they also say in the documentary that Henry's body, when it was being carried off to the crypt, the body exploded inside the casket, which was probably from the bacterial activity. It is also noted in Anne Boleyn's letters to Henry VIII that she was not able to be in court for 1 month because she was suffering from what they called back then the sweating disease, which in my opinion was probably Mycoplasma. And she might have caught it from him. And Henry VIII was so paranoid about getting sick that his physicians every morning before court started, they all had to look at the people who attended his court to make sure they weren't sick, because he was paranoid. In today's modern times, he would be called a hypochondriac. And coming up is the last person in history that's always fascinated me, and actually people paint him as a tyrant and a horrible king. And this was an English king, and it was George III. Now, George III was not a tyrant. He was what they call a constitutional king. Parliament called the shots, and his ministers called the shots. He had a say in things, but the country was run by Parliament, and the English king in America was considered a tyrant. But actually, the people in England loved him because of his morals and his faithfulness to his wife. He did not have mistresses. And one of the plagues of his family were that his sons and his grandfather and father took a lot of mistresses and had many, many, many illegitimate children. And this was a problem because none of these children were eligible to become king or queen. And it was just a big scandal back then, especially his son, George IV. Now, George III was considered mad. And after I explain things, you might not think the madness was brought on by mental illness. Now, George had many traumas in his life. Remember, traumas and stress cause mycoplasma infections. And back in the 17 and 1800s, sugar was a main staple of the aristocrats because they could afford it. So there's a little bit of facts about George III. He was born 2 months prematurely, and they thought he wasn't going to live, but he did. And he became king around 22 years old. Now, he was described as shy and reserved, which tells me he was a very sensitive person. And he and his wife, Charlotte, had 15 children. And he was a very loving husband, and again, never took a mistress. And he also loved his children and even played with them, but he was also a very strict father. Now, George inherited a war. He became king in 1760, at which time the 7-Year War was raging. It was Britain and Prussia against Russia, France, and I believe Spain and Austria. And this was a very costly war. And one of the interesting trivias about the 7-Year War, it started in North America over a conflict with the French about disputed territory. And an English company of soldiers who were led by Lieutenant Colonel George Washington ambushed French forces in a battle, and this actually began the 7-Year War. And it actually was a world war. Most countries were involved in it. Some became neutral. But again, George inherited a war, so this had to have been very stressful. And the war ended in 1763, and George experienced his first illness in 1765. Now, George had many bouts of depression, and at first, people used to think it was caused by this one disease that causes the urine to become blue, but it turned out he was treated with genium, which was a plant, and this plant was blue, and it turned the urine blue. So George was actually, in my belief is, George was suffering from depression, which people thought was madness. Now here's some more events where George got sick. In 1782 and 1783, he lost 2 boys in infancy. So in 1765, he had a brief illness but recovered. In 1788, he experienced an illness and recovered. And this time, when he recovered in 1788, they restrained him and gave him caustic poultices to ward off evil humor. And in 1789, he recovered. Now, this is interesting. In 1789 was the French Revolution. And France declared war in 1793 on England. And there was always a threat of French invasion of England in 1803. But Lord Nelson defeated the French in the Battle of Trafalgar. 1804, he got sick again and recovered. 1806, he had a lot of conflict with his ministers over Catholics being able to enlist in the army. Again, Catholics were suppressed in England. Now in 1810, at the height of his popularity, he was already virtually blind with cataracts and in pain from rheumatism. Now the following is the telltale giveaway that it definitely was a Mycoplasma infection that he was suffering from. Now George became dangerously ill. In his new malady, he believes, now this is what he believed, it was triggered by stress over the death of his youngest and favorite daughter, Princess Amelia, who died of tuberculosis. She was about 27 years old. Now the princess's nurse reported that the scene of distress and crying every day were melancholy beyond description. And here's another quote that George kept repeating over and over again when he was sick after his daughter died. He would cry in a wild, monotonous delirious way. "Oh, Amelia, why won't you save your father? I hate all physicians." So, George III had a lot of trauma through grief and mourning. The grieving process is very traumatic. Between the threat of invasion by France across the Channel, the American Revolution, which tainted him as a tyrant, which he wasn't. Then he inherited the 7-Year War when he was crowned king, which was probably really stressful. The traumatic death of 2 infants in 1782 and 1783 right in a row. The stress of his children being so promiscuous and having so many illegitimate children, and his son George IV racking up huge debt. He also had a lot of conflicts, political conflicts. So this really explains that he had a Mycoplasma infection and he had rheumatoid arthritis. It's another symptom. So I'm going to let you judge for yourself whether King George was really truly mad, mentally ill, or whether he was just suffering from a Mycoplasma infection causing hormonal imbalance. So this wraps up podcast number 19. I hope this was educational for you. And fortunately for us, we live in the 21st century and we are a lot wiser and know more than those doctors did in the 17 and 1800s. We know what causes cancer and disease, and we know what kills Mycoplasma, the most common cause of cancer and disease. So again, knowledge is the answer to know how to protect yourself from cancer and disease, especially with the upcoming 5G technology. I've been watching the news and I've been watching specials. People don't die of the microwave energy or the electromagnetic pulse. The 5G energy damages tissues, which set you up for cancer and disease. What they die of is infection, leukemia, brain cancer, breast cancer. These are all infections, Mycoplasma infections. Again, Mycoplasma attack damaged tissue and degenerative tissue and are activated by stress or trauma. And the next podcast, I'm going to add to the vaccine podcast that I did a couple podcasts before. It's going to be about the Gulf War syndrome and the dangers of vaccines. So until next time, good night and God bless.